You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, extreme smile makeovers. According to my first guest, if you don't like your smile, you can do something about it. With us, we have the Bay Area's go-to cosmetic dentist. We've had him on the program before, Dr. Joe Field. Dr. Field, welcome back to the program.
Thanks, Randy. Thanks for having me.
Now, you have a stack of photos, and it's true, in the Bay Area,
Yes.
and I'm not trying to endorse you. I mean, you are kind of the go-to cosmetic guy.
Have been for a while.
So we'll try to get to as many of those as possible. But
Right.
for people that don't know your practice, like who's your typical patient? Like who comes in for veneers?
Well, it's pretty rare that there's a dental practice that really has its emphasis on cosmetic dentistry. I mean, it's its own little niche, right?
Okay.
And so anyone looking for any type of smile enhancements is going to come. I mean, it's people that are saying, well, I'd like maybe my teeth a little whiter, right? Can we whiten them? What are my options there? Or I have a front tooth that's kind of dark. I mean, some people that have had trauma in the past, it's a pretty common thing. They get bumped in their teeth and it'll discolor over time. And so they'll approach our practice and say, can I fix just that tooth? To other people that are saying, there's something about my smile that I don't like. I don't have the confidence anymore. Or as I've gotten older, I've noticed my teeth are changing color. Or even they don't even whiten anymore. They've gotten darker and I can't get them to turn lighter and I'm self-conscious about it. So It's really a broad spectrum, and it's anyone that cares about their smile and the way the smile looks.
Now, and we should mention, you teach at USC.
I do. That's my alma mater. So, even though I'm up in the Bay Area.
So you're teaching other dentists how to do these complex full mouth reconstructions, as you call it.
Yes, and not just there. Also, I lecture across the country. So I love teaching. I mean, I love teaching my craft and helping other dentists just elevate the standard of care for their patients.
I always feel like I could spot veneers walking down the street. And I told you that, right?
Yes.
And I think you said over the phone, well, not mine.
Right.
They look very natural. So when I see big, bulky veneers or whatever, is that in the hands of the dentist or did the patient want that? What is your take?
What I've found, because I unfortunately get a lot of those in my practice asking them to be redone, which is always a difficult conversation for me, and when I sometimes even have to talk to the other dentist. And what I've found when that happens is it's done in a place or with a dentist where they're a really good dentist. They do a lot of crowns and fillings and they do that well. And they have a patient in their practice that says, Dr. Smith, I'd like to improve my smile. And Dr. Smith has a good relationship with that patient, said, okay, well, I can do veneers for you. And it's not something they do every day.
So they don't really teach this in dental school?
They don't.
So it's like everything you do after dental school.
Yes.
You have to kind of find a dentist that this is like, what? Like their commitment, their passion?
Their passion, their commitment, because it is a commitment. And then going back to that too, I mean, there's another point to it is the ceramic work, right? So I'm only as good as my partner with my lab. And years ago, we started our own dental lab. So I have in-house dental lab, does all the ceramic work. So I'm in control every step of the way.
Is that why you do it quickly? Like you say, if somebody's watching this, the day after tomorrow, they might be able to have a brand new smile.
Yeah, so I have people that come from as far as China that have come to get their teeth done in our facility. And so we have to be able to accommodate travel schedules, et cetera. So having everything there locally and having control over it, we can turn things around very quickly.
Okay. Now you're a dentist. So you probably think the smile is the most important thing. How important is it, in your opinion?
Well, you have a nice smile,
Thanks.
so you may not appreciate what it's like when maybe you don't feel as confident with your smile, right? And so, for example, I brought a graphic along. So this is from USA Today, a poll that they did.
We'll go to that graphic.
Here they asked just over 1,000 people, what's the number one characteristic that you notice in someone? And 44% said the smile. So this is general people, not dentists, answering this question, right? And so that's something that people notice right away. And far behind that were the eyes, right? And so the smile is number one. Let me give you another kind of reference here. So this is another graphic I brought for you. So here's a nice looking guy, with nice looking people around him. And when you see the picture of the guy in the middle, you notice right away he's missing his front tooth, right? So that's the first thing the eyes drawn to.
You can see that.
However, look a little closer, he's also missing something else. Right above his eye, he's missing an eyebrow. But that doesn't jump out to you.
You don't notice it.
You don't notice that, yeah. The smile matters. Another reference point, okay? So Muscle and Fitness magazine, right? Big magazine on health, fitness, wellness, etc. They did a survey not about anything other than what you look for as a trait in a spouse, right? So not physically necessarily, just a trait. Even with that, still the number one answer was the smile. Okay, so I know I'm biased. This is what I do. This is my passion. I design smiles. But the reality of it is, it matters. And for us, and I have veneers, so I cheated with my smile, but for us that we feel confident with our teeth and our smile, it's a different ball game. And if you think, Randy, about some of your friends, family, coworkers, etc., that maybe don't have a great smile, I'm sure you love the person, but you might think differently of them, right? And so the reality of it is, if
like maybe they're sad or they're serious or
even beyond that,
even stuck up.
Well, think about Hollywood movies.
Okay.
So when they want to portray a villain, do they have nice teeth and a nice smile?
That's right. Yeah.
When they want to portray someone of a lower socioeconomic status or, ignorance or whatever they're trying to portray in a movie,
they give them bad teeth.
They give them bad teeth, Randy. So,
interesting.
We get spoiled because, we're on a fortunate, blessed side where, thanks to dentistry, I have great teeth, etc. But not everybody has that. And if you don't have that, you don't understand what that means.
So there's a lot of people that don't like their teeth. I mean, you meet these kind of people all the time.
Multiple times a day.
And you say they confided in you like they never smile.
Yeah.
Some of them don't even date, you say.
And I'm talking like beautiful people, male and female, and of all ages, where you see them like this, you're like, that's a lovely person and great personality, and they won't show their teeth. They try to hide their teeth when they talk and when they smile, and that's how much it means to them to change that smile.
It's kind of a quick fix too, right? I know it's technically demanding on your side, but for the average person, it's fast.
Well,
right?
if we reference it to like maybe orthodontics, right? So orthodontics, where we straighten teeth and try to whiten them and make your teeth the best they can be, that can take a year and a half, 2 years sometimes, right? Whereas with these procedures, we can be done in days or weeks, right? So it's instant.
So you brought some photos. What are we looking at?
I did. I wanted to show you a few kind of before and afters of patients that have gone through this process and talk a little bit about why. And I pulled a group that I think embodied the averages of what I see day in and day out in my practice. Okay. My first client here, he came in and his concern was, my teeth are dark, they're not whitening, they're getting worn down and flat.
Okay.
And so he said, Doc, what can we do about it? What can we do to fix it? And so I went through the process with him and explained how we can use thin porcelain veneers to permanently change the color of his teeth.
Because they would, you couldn't do whitening on this guy?
Couldn't do whitening with them. They were internally darkened.
Okay.
So whitening is not going to do anything for that. And so we said, with these thin porcelain veneers, we can cover up the discoloration, permanently whiten the teeth, correct positioning alignment, idealize his bite, and give him the smile that he's wanted his whole life. So he opted for the upper and lower porcelain veneers.
Okay.
And one of the unique things about our process and what we do is the use of sedation. So he's able to be sedated, be very comfortable, relaxed while we get all the work done. And literally, he wakes up to a brand new smile. So look here, look at this.
Looks good.
I mean, it's amazing. I look at even his eyes.
It's like baby pictures.
Smile.
It's like you're so proud of these photos here. Good
They
for you.
are. I mean, the patients are like my family, and I still, I see him every 6 months at least when he's coming in for his teeth cleanings, etc. Still smiling ear to ear just like that.
So in the before photo, are most of these people, you say that it's tough for you to get them to smile for that before photo.
Yeah. Well, look at the reservation in that before photo, right? It's, we kind of have to tickle them to get them to smile a little bit, right? And afterwards, everything's just free. It's the confidence is there, the self-worth is there, and it's the same person. We just changed his smile.
And these veneers don't really stain
at all. Yeah, they're color stable is what we call them. So they stay that color, which is fantastic. No more whitening, no having to put all those trays in that taste terrible and with the light, etc. It's that color. That's what it is. Great. So I'm going to show you another one.
All right.
So this is a patient who came in who had veneers done years ago. We're talking over 20 years ago. And for very...
It looks pretty good. It's a beautiful smile.
It's not bad. And that's what I told her. And she was funny. She said, you don't get it, Dr. Field. I've been wanting to change these for 20 years, just haven't been able to get myself to do it. And so we talked about what was going on with the veneers, which they were starting to break down a little bit, but she just wasn't happy with the color. And she took ownership of it. She said, when I had these done, I chose the color and I should have gone lighter.
Okay.
And so she wished she would have gone to a lighter color. The other issue that she had was her lower teeth, as you can see in the photo, they're crowded, right? They're discolored. And one of the interesting things that happens as humans is as we get older, our collagen starts to droop a little bit. And so when we're in our 20s, maybe we show more of our upper teeth, or only upper teeth. As we get older, we start to show more of our lower teeth.
Just that lower. Okay.
So as she was aging, she's like, when I talk, I don't show my upper teeth anymore, just my lower teeth show. So in addition to wanting to replace her older veneers, she said, I got to address the bottom teeth now. And so as you can see here in the end, we were able to give her the color she wanted. We were able to fix the bite.
Very nice.
Fix the alignment of the teeth, and really give her a smile that she is so confident about. And it's interesting, if you look at her before smile photo, you know, she had a great smile, right? And very confident person, but she lights up now. And every time I see her, she gives me a hug, and she said, I love my teeth. I love my teeth.
Okay.
It's great.
Now, we should mention, you have this kind of like a digital way, like you're planning and designing this on a computer.
Yeah.
Because like you've told me that on that after, it's like the teeth seem to fit perfectly in the mouth.
Correct.
That's done on a computer. Elaborate on that.
And you know, it's a good point, because with her, that was crucial. For someone that's already gone through the process before and knows kind of how it's done elsewhere, or how it's used to be done in other practices, where I call it an analog version, right? It's, you know, they prepare the teeth and pray, right? And hope it all turns out the way they want it to.
Okay.
Okay. So with this digital process that I do, I'm able to do what I call an architectural design based off their face, their lips, their smile, their nose, their eyes. All of that information gets built into what that smile design is going to be. And then I can sit down with my patient and say, here you go. Here's the design that I'm coming up with based on all of these aesthetic principles, your facial features, etc. What do you think? What things do you like? What don't you like? What would you like to change?
So they get to kind of see it ahead of time?
Exactly.
All right.
And so they get to be involved in the process. Ultimately for her, that was a huge deal, because she had a little bit of that emotional baggage, if you will, from how her experience was before, because she felt like she didn't have a lot of control. It was just the dentist just said, okay, here you go, we're done, right? I like to team up with my patients and make sure I'm meeting expectations and giving them a clear view of what we can do for them.
Is this one of the things you teach at USC?
It is, yeah. It's a new technique. It's not being done very, very many places. And the fact that we're able to do it for our patients is a huge reason why people come to us.
And it doesn't cost more to do it at this level.
No, of course not. Yeah, and the reality of it is, it makes it easier and saves people a lot of headache and hassle.
We're going to take a quick break. We come back, more of the photos and more about the veneering process. You're watching the Wellness Hour, news that makes you healthier. We'll be right back.
My experience with dental work was like most people that avoid it. I was traumatized as a kid, and so over the course of the years, I'd lost 5 or 6 teeth. But anyone you meet new is always a challenge and always very awkward, and in the end, very depressing. My mother and father both had false teeth, and I didn't want to do that. The convenience of never having to take out your teeth at night would be worth whatever the difference is between just plain dentures and having this procedure done. The actual procedure took about 3 hours. I just had the uppers done. The bottoms were okay. The one thing I remember about the whole thing, other than looking a lot different when it was over, was the lack of pain, because I had always associated dental work with real bad pain. Ever since I've had the surgery, people noticed it right away. And I feel so much better about myself. I don't have to hide the smile anymore. You're not so ashamed of the way you look. Nobody's going to take me for the sour old man that I probably was before the procedure. And so far in the 3 years since this procedure, I haven't had to go back for any adjustments or any redos or anything like that. It was one and done.
You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. We're talking about, this is a special edition, Extreme Makeover Edition. Change your smile, potentially change your life. With us, we have the Bay Area's go-to cosmetic dentist, Dr. Joe Field. Dr. Field, welcome back to the program.
Thank you.
And look, and I'm trying not to endorse you. I've been doing the show for about a little more than 22 years, and these photos look good.
Thank you.
Good for you.
Thank
good
you.
stuff. And they look natural, because I'm always skeptical, because I feel like I could spot big veneers. So how much is art and how much is science? Because you teach at USC
Yes.
these principles, but do some guys just have it? and some don't? And can you teach the art part?
That's the challenge with this, because it's almost all art, right? And at dental school, we get taught the science. We become really technicians of the mouth, right?
Okay.
To understand the artistry of what goes into smile design and what makes a beautiful smile, that takes a long time to develop that attribute. And quite honestly, some of us are better accountants, some are better attorneys, some just don't have that in them to become
The art part.
the artistic dentist, yeah. So let me show you another example. This is, often I have patients coming in that are about to go through some big life events, right?
Okay.
Whether it be a wedding, family functions, et cetera. That's pretty common.
Divorce, people do this for?
Divorce as well. They're kind of
They're
on
single again?
Yeah, they're out back in the dating scene after how many years, So it's a very common thing, and it's fun for us to go through these big events with people. Divorce may be less fun, but it's fun to go through these life-changing events with people. And the stress for us is a lot of times they'll come in and it's kind of the last thing they've thought of, right? They've handled all the other details, and then they're looking in the mirror and they see their smile, and
Okay.
they think, okay, we got to fix this. And so oftentimes they're coming in and they say, I need this done in a week. I need this done in 2 weeks, very little time. So fortunately with my own lab, we're able to make that work.
So you do everything right there.
Yeah.
You're saying, okay.
So this is a patient who, had really dark teeth, lots of wear, etc. He was not not that old, but because of his teeth, he looked a lot older than he really was.
Okay.
And same thing, going for a big life event, a little bit of time for us to work with. And he said, Doc, I want the Hollywood smile. Okay. So and by Hollywood, I mean he wanted whiter than white.
All right.
And so actually the white that we used here, we had to create on our own in our lab to get him white enough. Not very common. This is why I showed this case, because it's kind of unique. But this is where we ended up, and you can see I was concerned going into it. I always try to, keep everything looking more natural.
Looking good.
But it actually works for him. It looks great.
It does.
And he's thrilled. I mean, look at that smile. Look at the before, really tentative, not wanting to show his teeth, not wanting to really smile big. And then after, it's huge. He's lighting it up. He lights up the office when he comes in.
Well, it's
literally.
like anything else. I mean, my guess is when you like the way your smile looks, you start smiling more.
100%.
Is that true
100%,
with your patients?
yeah. What I've found is people even have to relearn to smile. So they've got.
What do you mean?
Well, so many times when patients are uncomfortable with their smile, they learn how to hide it, right?
Okay.
So they learn how to not really show their teeth when they smile. And so once they have the brand new smile, they'll tell me, like, Doc, I got to learn how to smile again. I got to learn how to move my lips up when I smile. All of that has to be relearned because they spent years hiding.
Okay.
So let me show you another one.
All right.
So you asked about the typical patients that we see, and this is the next two actually are in the baby boomer generation.
Okay.
So a lot of times people say, well, I'm in my 70s, even 80s, who cares? They still care. It still matters. Very active lifestyles, etc. This was a gentleman, let me show you. He actually went through orthodontics to straighten his teeth, but he had a significant amount of wear and chipping on the teeth. And that's just has happened over time, especially with the bite situation that he had. And so he said to me, he's like, look, my teeth are straight. I thought it would make me look better. But the fact that they're still chipped and broken down, they look old. I feel like I have old teeth.
Okay.
And so we went all the different options. And for him, again, he chose to go with upper veneers and then lower veneers just on those front teeth that were the most broken down.
Very
and
nice.
Look at that transformation. And so from a bite standpoint, much more stable, much stronger teeth. He's not worried about them breaking, when he takes a bite out of a corn on the cob. But also aesthetically, it's a beautiful result. And aesthetics weren't necessarily his driving force, but he's thrilled with his new smile. And again, you can see it in the photographs.
Now, when you're on a consult with someone, do you in your mind see that end result? Do you feel like, I know this is going to be a home run or slam dunk or whatever you call it?
Yeah. I'll tell you, the most common question I get asked is this the worst you've ever seen?
Really?
Right, which it's not. I've seen it all. But what I talk to patients about, especially those that have a lot of emotions tied to their embarrassment of their smile, I paint them the picture of where we can go and what we can do. And I can create in their minds the vision. And I tell them, I said, look, don't focus on where you are right now and don't focus on what's bothering you. Let me talk about what's possible and what we can do. And then we'll work backwards from there.
Very nice.
Yeah.
And by the way, so I guess and we talked about this before we started, recording here, but you said that because you're doing this digital pre-planning, that you couldn't do it the old way, which is still being done in most places.
Right. It would be hard for me to go backwards. Okay. So most places are doing it in this analog version, right?
Like putting them on and hoping that it looks
it's
right.
okay. Yeah. For me, I'm so used to having predictable results, having veneers that look beautiful, not too big, not too bulky, and having patients that know what they're going to get in the very beginning and have those expectations met. That I think back to how we used to do it, and I feel like I got lucky, right? Just most of the time, it would kind of work out, and I'd be doing a lot of adjusting in the mouth to try to fix things, etc. Now it's literally, it goes in, and it's
Goes
done.
into the computer.
Into the computer, gets manufactured based off that with my lab, very talented people, and then we go right to the mouth with it, and it's done.
Very nice. Time for some more.
So here's a woman who came in because she broke a tooth. Okay, so one of their teeth was broken. She has a pretty nice smile.
Yeah, looks good.
Yeah, and she didn't have a lot of embarrassment or none of those things about her smile. But as we were talking about what goes in now to replacing the broken tooth, and talked about her bite and how the teeth were hitting and why it broke in the first place, we started talking about the options. So again, I talked about, what do you want your smile to look like? Did you know that we can do this? Did you know that we can do these thin porcelain veneers to change the smile, change the teeth, make it stronger? And as we started talking about that, I could see the wheels kind of turning in her head.
Okay.
She's like, oh, I get what you're saying. And so again, in her case, once we got the broken tooth taken care of, then we went through the process of giving her upper and lower veneers. So if you can look here at the after.
Looks good. That's a good looking
Huge difference, right? And this was someone that didn't necessarily think, oh, I'm coming
like
to
perfect
Dr.
teeth.
Field for cosmetic dentistry. Yeah, exactly. She was very happy with it. And it's a really neat story to hear how now she feels so much more confidence. And I would have said, meeting her initially, this is a confident woman. I would never have guessed that she was self-conscious about her teeth. And a lot of times we don't know that about people.
Time for some more. I mean, you have a stack of photos, photo after photo after photo.
I do this every day, Randy. So I see a lot of patients, right? So it's fantastic to be able to help people change their lives.
So let's take a look at some of these. What else you got?
So I got another, this is a patient that came in, very busy executive, and she is very hard on her teeth. And it wasn't necessarily she was looking for a cosmetic fix, but her teeth were starting to crumble. She was literally like breaking little pieces of her teeth off as time was going on, which was a concern for her. And so this is, you can see as we went through the different options, really she was an ideal candidate for what I call a full mouth reconstruction.
Okay.
So this is a veneering process that includes the back teeth as well, so that we can rebuild the bite and balance those forces the way they need to be. So let me show you the after photo here.
All right.
So you can see
Very nice.
all the teeth in her mouth were restored. So it made a huge difference with her smile. I mean, look at that photograph. But also in her case, just with the way that her bite felt. She felt more comfortable, more relaxed, able to chew what she wanted to chew.
So we're talking, when you say bite, it's the way the teeth come together?
Yes.
Has to be fixed?
Yeah, a lot of people, and that's why we do orthodontics and braces to try to line teeth up. There's a reason for that. It's not just because they look better, but they work better.
Okay. And they'll last longer.
Absolutely, and less prone to chipping and wear, etc. And the interesting thing with her is there may be some places that she would go and they would tell her, look, we can't save these teeth.
Like on that before photo, those lower teeth, they look pretty bad.
Yeah, and they would say, you gotta take them all out, we gotta do implants and do a whole different reconstruction process. That's very expensive and costly and time consuming. In her case, I said, absolutely not. Those teeth are structurally sound. We just gotta get the decay out, fix the structure that's broken down, help the gums heal a little bit, and you can see the results there.
Yeah, looks good. I mean, it looks like the teeth of a 20-year-old.
Absolutely. And if it were me, if I had the choice, I'd rather save my teeth. So I'm gonna show you another one. And this is a pretty common thing as well that I see in my practice, where missing teeth, have been missing teeth for a number of years. So you can see missing some of those back teeth. And she needs to get her bite restored, et cetera. So it's just not just about the looks, right? There's the part of how the teeth work and how everything feels. And this is a case of that. And so she had some old crowns on her front teeth that she didn't like the color of, and just starting to get the chipping. And she said to me what many patients say is, I feel like my teeth are looking old.
Okay.
Right? And
okay.
she's not old. And so you can see with her, we were able to add some dental implants and do a reconstruction.
I'm laughing because that after photo, I mean, she just looks happier.
Totally different person, right? Way more confident. Her smile is so much more free and relaxed and happy. It's just a wonderful thing. And Randy, this is not for everybody. I mean, she was missing some teeth. Maybe she just gets a couple implants and off she goes. But she really wanted a transformation. She said, look, I'm fixing my bite. I want to make it look the best it can look. why not? So there are those that want to do that.
So we got about a minute and a half left.
Okay, let me just show you a couple more.
Okay, 2 more. Let's do it.
So we talk about the demographics of people that do this, right? And some people think, well, it's only like rich and famous people and people you see on TV getting this
Or
work
younger
done.
people.
Or younger people.
Okay.
So this is a gentleman, one of my favorites. He is a professional dog walker, okay?
Okay.
And he came in and said, look, doc, I feel like my teeth make me look like a villain from a movie. What can I do about it? I don't want the Hollywood smile. I just want my teeth to look good. I want them to be healthy and be able to function. So check out his after photo.
Very nice. And is that what, just veneers?
That is, yeah. So look at the after.
Looks good.
And one interesting thing you'll notice about him, the teeth don't look very white. I mean, they're still fairly yellow. That's what he wanted. So it's not about what I want.
Why does he want that?
He wanted them to look as natural as possible. He didn't want
So
people
all
to
of his
think
friends are noticing.
it's nice as a nice smile, but it's
Okay.
in his mind age appropriate and it
Okay.
doesn't look fake, right? It's what he wanted. So it's not about what I want. It's about what my patients want.
Very nice.
One last case,
All right,
okay?
all
I know
right.
we're running out of time.
All right.
This was one of my most emotional journeys
Okay.
with a patient, okay? So this was a patient who, in her late 30s, lots of disease, right? Lots of gum disease. So again, it's not only about cosmetics, right? There's a health function to this. So this was one where we went through a cosmetic process. It did involve implants and a reconstruction with dental implants because we lost the bone support and we weren't able to save these teeth. So this was an example where sometimes we can't save the teeth and we can use implants as our friend to give us the aesthetic and the bite force results that we want to get. So let me show you her after.
All right. Very nice.
Huge difference for her. The reason this was so emotional, she was in tears during our consultation, so embarrassed about her teeth. She said, I have 3 kids, I've dedicated my life to my family, I've never thought about myself and my health, and my teeth are starting to get wiggly, I can't eat things anymore, it's my turn. And the transformation, I brought her husband in the day that we put the teeth on, he came in and then he started crying.
That's
right?
nice.
And he sent me a really nice note afterwards talking about how I changed his wife's life. And that's the kind of stuff that just, you can't put a value to that.
Good for you. Good for you. Final message. Somebody watching this, they don't like their teeth, but maybe they're afraid of the dentist.
Yeah.
What do you say to them?
Well, I want to know there's options, right?
Okay.
First of all, there's options to help you like your smile. No one should be walking around embarrassed or ashamed of their smile. There's just no reason for that. And I also am afraid of the dentist. I hate being a patient.
Really?
That's why I do sedation for my patients.
Okay.
Make it a pleasant experience. I often have patients say, that was the best dental experience I've ever had. And it is. It's a great way to go through this process of really changing your life.
Dr. Field, excellent. Thank you for coming on the program. Good stuff.
My pleasure. Thanks, Randy.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.